Anoscopy is a procedure to visualize your lower rectum and the anus. Usually, doctors recommend this procedure when they suspect internal piles, anal fissure, fistula in ano, or any lower rectum or anal canal pathology. Treatment procedures such as rubber band ligation or foam sclerotherapy for hemorrhoids are usually done under the anoscopy guidance. What is an anoscope? See, it's a solid hollow tube which is around 2 to 4 cm in diameter and around 4 to 6 inches in length. Before proceeding with this procedure, I usually ensure that the patient had a good bowel motion in the morning, because if the feces are incomplete evacuated, the visualization will be very poor and the patient will require a repeat anoscopy on some other day. So what I do, usually I give some form of laxatives on the night before this procedure to ensure the patient has a very good bowel motion. Most of my patients are very apprehensive and anxious before this procedure. I always ensure that my patients are totally counseled before this procedure, because see what happens when you are apprehensive, the muscles in your anus are in a contracted state. If this sphincter or the muscle in the anus in a contracted state, the introduction of the anoscope via the anus becomes difficult, and because of which the procedure becomes painful or cumbersome for the patients. So I ask my patients to take deep breath during this procedure. The anoscope is thoroughly lubricated with a jelly and it is gently introduced via the anus. Once I get a good view of the rectum, the lower rectum, gently the instrument is withdrawn under vision. While some pressure or discomfort is expected during or post procedure, but most of the patients do not experience any pain, the only exception being anal fissure. And why? Because in anal fissure, the muscles are in a contracted state, so patients experience pain during this procedure. Otherwise, the recovery is totally pain-free. In cases of hemorrhoid, you might observe some drops of bleeding post-procedure.